After suffering an injury that could have ended his career, hyperbaric medicine got this police officer back in the field.
Approximately a little over a year ago, I was splitting wood in my house with my family. My father-in-law was walking by, and he saw me struggling. He came over and offered to help. We weren't on the same sheet of music, and I ended up moving the log once. He thought it was ready. He ran forward. I went to reposition the log, and I stuck my finger down in between the log and the ram, and it crushed my pinky. I'm currently working at the Pleasant Valley School District as a school police officer. The first thing running through my mind when this injury occurred was, am I going to be able to work again? The main thing, if I wasn't able to maintain control of my firearm when I shoot it, then I'm no longer can work. And this is all I've ever known since I've been 22 years old. St. Luke's recently moved up there, so we went right into the new Monroe campus and went through the ER that way. After the initial ER visit at the Monroe campus, they sent me down here to the Bethlehem Hospital, and that's where I encountered Dr. Millet. After the initial surgery on my finger, the top part of it did not survive. We were going to do probably a full amputation of the finger. And I signed the paperwork, we came out in the hallway, and I said, Dr. Millet, I said, can we have one more week? Just give me one more week, you know what I mean, to see how it does. Probably around 6:30, 7 o'clock at night, the phone rang, and it was Dr. Millet. He's like, listen, I've been throwing a lot of things around in my head. He goes, they have this treatment, this hyperbaric oxygen treatment that is for crush injuries. We'll send you over there, have Dr. Bauer assess what's going on and see if this is an avenue we can explore.
It was a pretty nasty injury. I wasn't sure if we were going to be able to save his finger as a result of it. Robert, in his life's work as a police officer, was concerned about it because it happened to be the hand he held his firearm with.
He was referred here for hyperbaric treatments from Dr. Millet, who is the plastic surgeon. After a crush injury like that, you lose blood flow to that finger, and it's really a question is how much can actually be saved. Hyperbaric medicine, we increase the oxygen to 100%, increase the pressure, and deliver 10 to 15 times the amount of oxygen to tissues that need it.
The wound care center was phenomenal. When you go in there, you're like family.
We work well as a team.
With each and every patient, there's a tailor-made plan.
A bunch of people that can work together and give the best care possible.
We ended up able to save it by doing that treatment. I'm very pleased with the whole outcome, and I'm actually thankful that I didn't drive past St. Luke's.
The most rewarding part of my job is achieving the result that the patient wants. And if we can make that happen, then we've done our job.
We were really excited to be able to be part of Robert's healing, and we were really glad to hear he went and passed his firearms exam and is back working and back to his normal life.
Hopefully nobody ever has to experience a traumatic injury, but if they ever do, it's nice to know that St. Luke's Wound Care Center is there to get you through your difficult time in life.
Joining me in the studio is Tara Steiner, a nurse and wound care clinical coordinator at St. Luke's University Health Network. Tara, thanks for being here.
Sure.
So tell me a little bit about wound care and hyperbaric medicine. How important is it to the healing process?
There's a few different reasons why we use hyperbarics, but it really helps to increase the oxygenation in that patient's wound to try to help the tissue heal faster.
What kind of results do you see, and what's the feedback that you get from patients? I would imagine, every story we've told, it's pretty amazing.
It is. It's a time commitment for them every day, but the end result usually is very good for the patient.
What about pain? Is there any pain involved with hyperbaric medicine? Is there anything people need to know when they're making the decision whether they're going to participate or not?
So there's not really pain involved. They are in a chamber. It's a single person chamber, so they lay in there. They're able to watch TV in there. We're able to communicate to them by phone.
Well, that's good. At least they can relax.
Yeah. Right. So, but really no pain. It's similar to scuba diving or flying, where your ears, they need to be able to clear their ears. And then they're just kind of laying in there for about 2 hours for
So
their total
enough time to watch the movie.
So right, so they usually can finish a movie while they're in there, and certainly we give them a list of things that they want to look for to tell us if they're having a problem.
How do you determine when someone comes in for wound care, and there's a variety of ways to treat wounds, how do you determine when hyperbaric medicine, hyperbaric chamber is the next best step for a patient?
So hyperbarics is something that we use for specific types of wounds. Probably the biggest one being diabetic foot ulcers as far as a wound goes. So a patient who is diabetic and has a diabetic ulcer that's severe enough for a 30-day course and is not responding to any conventional treatment that we do, we would look at putting that patient in hyperbarics.
And what about the other services? If someone has a wound that isn't healing, how do they find wound care at St. Luke's, and what other kinds of services do you offer?
So we do a lot of different types of advanced therapies. Certainly once we see the patient, we look at their wound and come up with a plan and figure out what the best plan is for them. Hyperbarics isn't the only thing that we do, so we have a lot of other things out there such as skin substitutes, special products that we use. There's different types of other treatments as well that we can do to try to help the patient heal as fast as possible.
Well, you're also a nurse, and you've done a lot of patient care over the years in a variety of fields. How do you find wound care, and what is it like for you as a nurse to help patients on this journey?
So wound care for me, I've been in wound care in an outpatient setting such as St. Luke's for the last 10 years. It's really rewarding because in nursing, not always everything is rewarding, and for us, probably 95% of our patients we get to see heal and they get better. So you don't always see that. Right,
Yeah, that's
right.
amazing.
Yeah.
What do you want patients to know about the kind of care that they can receive at St. Luke's, and that there is kind of help out there for them? I think people worry sometimes when a wound isn't healing, they don't know what to do.
We see any type of open wound, so it doesn't have to just be on your leg or your foot. We do lots of different types of wounds, so give us a call and we'll try to help you through your process. And if we're not the right place, we'll get you to where you need to go.
Excellent. So help is out there. Tara, thank you so much for joining us.
Sure. Thank you.
For more information on wound care or hyperbaric medicine at St. Luke's or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember, every day is an opportunity to be your best self. This is The Peak.
It's Katie from the ASR team here. Thanks for watching. Give us a thumbs up and subscribe to our channel for more videos.